Our next topic is Zone 2 penetrating neck injuries. Expectant. Now, expectant management is observation only. Selective management when you do a diagnostic workup should not be an option. This is Dr. Rao Ivatury is taking the pro, and Dr. Nathaniel McQuay, who is an assistant professor at Johns Hopkins, he's at the Bayview facility, is going to take the con. So, Dr. Ivatury.
Thank you, Dr. Britt. Good afternoon. I just would like to say a couple of things before I start the topic. Is that after a long time, I'm getting a pro position. Dr. Britt always gives me the con position, so I wonder if he really thinks I'm a con man or something. And my second comment is that I just want to pay a tribute to Dr. Britt. I mean, his moderating skills is getting better and better. We've been doing this now for 3 to 4 years. And I have seen no other conference where a moderator sits from the beginning of the conference to the end of the conference, stimulating everybody. So I think we should give him a big hand. And he also makes it very, very difficult for the speakers to understand what he's talking about. These double negatives and double positives and negatives, all combinations in the same statement, makes it extremely hard. But I'll try to do my best. So we are talking about Zone 2 penetrating neck injuries. I don't need to tell you what Zone 2 neck injuries are. And he says that expectant, in other words, observation only, is not an option. So I could interpret this two ways. One is that he may be meaning that we really have to mandatorily explore all these things, but I don't think he's talking about that. Please don't think that you're doing that. And second, I think he's talking about how we just cannot observe the patients by physical examination alone and expect a good result. So I think that's the position I'm going to argue for. So just as a preamble, we really don't need any controversies about hard signs for operative intervention. And we all agree that these are the hard signs: active external hemorrhage, pulsatile expanding hematoma, hypovolemic shock, neurological deficits. And these are the kind of patients you wouldn't think twice about taking the patient to the operating room. There are soft signs for operative intervention where the patient presents with a Zone 2 injury with a hoarseness, hemoptysis, crepitus, or stridor. And Dr. Dimitriadis told us in 1996, about 80% of all transcervical gunshot wounds can be managed conservatively. And that's a significant statistic, which is true in most of our civilian trauma centers. And the state of the art is to get a CT scan and evaluate the trajectory of these bullets. Unfortunately, most of these bullets don't really follow one zone, so there is an area of complexity we need to deal with. It is a series from Bell et al., 2007, 134 consecutive patients. 120 patients had platysma penetration. As you know, a few decades ago, these patients would have gone to the operating room for a mandatory exploration.
Good afternoon, everyone. Dr. Britt has known me my entire training and, I would say, professional life. He's one of the sole reasons why I am today. But for the past 3 years, I felt like Dr. Cornwell, I've done something. And he won't tell you if you've done something wrong. You can tell by how he treats you. I'm relatively young. I think in my career, I'm at the transition point. I'm in between the X and the Y. But for the past 3 years since I've been here, all the giants that I read about, you put me up against. First, it was Stu Mervis. He didn't show up. I don't know if you told him not to come. Then I had Dr. Feliciano for 2 years. Now I have Dr. Ivatury, who came from the institution I did my medical school at. So I'm going to do the best that I can, but we're going to talk about the exact question that was posed. And I do agree with you, Dr. Ivatury. Dr. Britt has a unique way of putting questions. And he gets on me about this, but when I do this, I read the question, and then I rephrase it so that I understand it, because I'm just a simple surgeon. I'm from the South, so it must be simple. So the question that we're going to address is this: Zone 2 penetrating injuries of the neck, expectant or management or observation should be an option. So that's the way I'm going to address this. So we must have some definitions. I tend to be a definition person. So what's zone 2? We want to make sure we look at exactly what we're being asked of. And as you can see here, zone 2, we all know from the angle of the mandible down to the cricocardiac. That's what we're going to talk about. This is a representative of a young gentleman with a gunshot wound to zone 2. The question is expectant management an option? Not ideal, not suboptimal, but an option. What are our treatment options? And we must be clear on the definitions. And we know these ad nauseum, but I want to make sure we're clear. Operative management, as he says, Stevie Wonder could figure that one out. Selective management is what I think Dr. Ivatury gave you the affirmative on, but didn't address the actual question. Now, reading the literature, again, we talked about this before, you must dive deeper into what they're talking about, because selective management, when they talk about it, they often mix it with expectant management. But the question is purely expectant management. So that's what we're going to talk about here. We already reviewed the hard signs and soft signs of an injury. And remember, the physical examination is the basis of all of this. This is nothing but Barbara Bates. Patients either have positive signs that are associated with a significant injury requiring intervention, or they do not. That is what we must keep in mind as we go forward. So with that as a platform for the addressing of the question, what's the evidence? Here's a paper we talked about before from out of LA County in 1993, looking at physical exam and selective or conservative management, as they say. 335 patients, prospective, I'm supposed to bring the best evidence, prospective. Physical exam protocol, I think, gives strength to this. There's no variability in terms of how you do your physical exam. 95 patients, 30% zone 2 injuries were included in it. Remember, that's the question, zone 2. 28 explored, 26 found to have significant injuries. 66 of the entire population were explored. 269 patients conservatively managed, i.e. expectant management.